Today, more than any other time in our history, America's children face an unprecedented number of societal dangers. Dangers that may threaten their futures, as well as their very lives, for which most existing school programs are not equipped to address effectively.
The challenges of alcohol and other drugs, abusive behaviors, addictive behaviors, accidents, particularly automobile accidents that occur because of that, depression, suicide.
Frequent visits to the principal's office, poor achievement, looking at going to summer school, or maybe repeating 8th grade.
Questions about sexuality, questions about use, questions about how do I fit in with this thing called school and how does it connect with my future. I think kids are struggling with that earlier.
They don't have health insurance. They're not able to go to the dentist. They come in with toothaches.
Bullying. Anywhere we go, that seems to be the #1 priority for schools.
From gangs to, the parents just not being home because they have to work 2 and 3 jobs.
We need to have a plan in place how we're all going to work together.
Such help exists for educators in the Masonic Model Student Assistance Program. This training program was created by former educators Larry Newman and Tom Stecher to acknowledge these dangers and to train educators to identify and effectively deal with children at risk of substance abuse, depression, suicide, or violence. The Masonic Model Student Assistance Program, or MMSAP, is an intensive 3-day training workshop designed for teachers, administrators, and other school personnel that is offered to educators at little cost to them by Masonic lodges in their state. The Masonic Model Student Assistance Program trains a school core team comprised of 5 to 8 educators through practical sessions designed to simulate real events, along with presentations on such subjects as chemical dependency, depression and suicide, bullying and violence, life skills development, and group process. Participants leave the training with a specific action plan for behavioral interventions and a system for implementing MMSAP in their schools. Since its inception in 1986, the Masonic Model Program has trained more than 40,000 educators across the United States and provided crucial assistance to more than 500,000 children at risk.
What schools don't want is yet another group, yet another committee. So we look at how we can fold what we do into what they're already doing. It really takes a look at the work that's been done by the Search Institute out of Minneapolis. And it's been done for almost 20 years, where they're taking a look at what they call the developmental assets for children. And it's a research-based model that says the fewer assets I have, the more at risk I am.
And the Masonic Model Student Assistance Program takes a team of educational interventionists and trains them to identify early and often and create intervention plans to make change in students' lives.
We became much more interested in that we really need to take a look at this model to see if it had applicability for our grade level. And we certainly have found that it has.
This isn't just data, it's not just research. You're talking about your life, you're talking about our lives, you're talking about all of our families and all of our children. That's a significant distinction in this program.
I've had people, either in a written evaluation or in a verbal comment, say that they are better people as a result of being in this room. And I think part of it is we build a caring community here that they can then model and take it back with them.
And it teaches you step by step on how to handle the problem, how to manage the problem, your role in it, and how you should play it, and all of the actors around you and how they play it.
It's been a great opportunity for us to come here and revitalize ourselves as a group to say, hey, we're doing a good job, but here are some of the things that we can work on. Here are some of the strategies that we can walk away with on the last day and implement as soon as we get back to school and start meeting again to inform teachers and to support students. I think that's our biggest thing.
The more we are preventive, the more we focus on early intervention, the data is clear, the better learners we will have, the better teaching we will have, and the healthier school community we will have.
You have to be able to do staff development so that teachers understand all the campus resources, all the resources that are available and how to utilize them.
I think that is a big big part of what we do, just making them feel safe. You know, if you don't feel safe, you know, how can you
learn?
Yeah, how can you flourish?
So the Masonic model is definitely, I would say, has taught me how to nurture myself and also nurture the students' needs. And I mean, that's honestly what it's about. When you talk about education, it's about the students' needs.
Address self-esteem, address socialization skills, address the social and emotional learning needs of our children.
So it basically challenged us as educators to come back to the table and say, well, I have to recommit myself.
If I can increase my attendance, that means more money for my school system. If I can increase academics, that means a higher regard for my school district, nationally, statewide, and locally. If I can decrease my behavioral problems, then I'm going to have a safer school. If I can increase my academics and standardize test scores, I've got more children going on to college. I have more children graduating from my high school. It's a win-win across the board. For an administrator to send a team, to send herself or himself to this training, goes back and says, I am creating a safer building, I am creating a well-attended building, I am creating a better academic building, and I am creating a building where the discipline problems dissipate.
How much is the life of a child worth? My belief is every person in this room impacts a half a dozen or more kids per year.
The more people that know how to identify at-risk children, the more lives we save. It's that simple. So who should come here? Everybody that cares about children, who has a part to play in the educational life of that child.